So, picking on the audit one first, what are some of the
Yeah.
things you see most commonly that you would tell a long-term care pharmacy today? Hey, you ought to be paying attention to this if you're not already.
Yeah, it's a funny thing. When I first came to PAAS, there was an inside joke that it's like long-term care is different because it is so different. And really, a lot of our staff here have never had the
Yeah.
experience of working in a pharmacy to truly understand and appreciate what does it mean to be in a long-term
Right.
care pharmacy. And so LTC is different. It's very different than community pharmacy. It's very different than what a lot of patients come to expect when they think of a pharmacy and walking in to get a
Yep.
refill. And so there are a couple of components that LTC pharmacies face when they get audited, because auditors often also struggle with those
Right.
same challenges. They don't understand the space, they don't understand LTC orders, and so they're very lost
Yeah.
when it comes to that. And that can be to the detriment of the long-term care pharmacy because they're used to auditing, let's say, community pharmacies, and then they audit an LTC pharmacy and it doesn't fit
Right.
round
Their
peg in a square
checklist.
hole.
Right. Yeah,
It doesn't
exactly.
fit. And so then they're going to mark it discrepant or flag it for potential recoupment. And so when I think about LTC audits, I think there are three things that pharmacies primarily struggle with or think about that I would caution them about. And the first one is thinking about just orders in general, because these prescriptions often, while they may be an ERX or an electronic prescription and look like a retail order, often they may be a chart order or something else when you're working with skilled facilities. And PBMs will traditionally, even with a chart order, look for a quantity or duration. And chart
Got it.
orders, almost by definition, don't
Don't
have
have
those
either of those
elements.
things. Yeah. Yeah.
Yeah, so that's the first challenge. So it's not that you can't have a chart order, but often then you have to have additional documentation to support that chart order. So you get a chart order, let's say you get it in October, and then they're auditing for a data fill in January. And so what often might have to happen is the pharmacy needs to obtain the MAR or some other corroborating documentation to show, yes, this was still in effect. This order wasn't DC'd from the October physician order sheet or chart order. And so I now have to get a record of the MAR or something
Yeah.
else. And so it's additional, and depending on the pharmacy, do they have connectivity? Do they have
Yeah.
access to the MAR? Do they need to rely on the facility? Is it a paper MAR?
Right.
Still
Right.
at today's age? And even, are you still working with that facility? So if you have churn or you're turning over a facility, how easy is it for you to ask them a year later for a record of a MAR when you're getting audited? How likely are they to be cooperative with you?
Right. Right.
And so those are some elements. So the hard copy is a big thing when I think about one of the first components I would worry about or think about, and what does it look like, and the type of facility. There's a lot of different state regulations. So we're at all 50 states, and
Yeah.
all 50 states regulate long-term care differently, what they require from assisted living, and how do they categorize assisted living. Here in Wisconsin, we have two terms called CBRFs and RCACs. And if you say that outside of Wisconsin, they don't know what
I know. I
you're
was like, I have
talking
no
about.
idea what you just said.
Yeah, and so community-based retirement facilities, CBRF, and
Yeah.
RCAC, residential care apartment complex. Those are like our ALFs, and we have adult family homes and other
Yeah.
things, but
Yeah.
they're very unique. So it's very state specific. So what does the state allow you to do within dispensing? And do they call it out? A lot of states are vague. It's been an evolving continuum of care over time that skilled nursing facilities are being asked to do more what hospitals used to do, and assisted livings are asked to take higher acuity patients and keep them out of skilled nursing facilities. And so the practice has kind of evolved over time, and sometimes state laws and regulations lag what's actually happening out in practice. And so what does your state allow you to do is often important when it comes to an audit as well, and defending against an auditor who doesn't think this order is valid or this
Right.
patient really should have had that. So first thing is the hard copy. The second thing that's different about LTC pharmacy with audits is signature logs. So in community pharmacy, of course, the patient presents, they'll sign, or if you're
Yeah.
delivering, they may come to the door if you're doing that, or if you're mailing, there's some components there. But with signature logs, you're often delivering to a facility, of course. And so depending on the time of day or typically time of night, if you're
Yeah.
running a nightly
Yeah.
run, I had some orders that would get at the facility at midnight or 1 o'clock in the morning. and you have one person or hopefully somebody answers the door to let you in to sign for the drugs. But signature logs, not only having a facility address and some of the basic components, needs to be signed. During COVID, we had this waiver, right? During the public health emergency, you didn't have to have a signature. The PBMs had waivers in place. But now that since May 11th of this year, we're outside the public health emergency, signatures are back fair game.
We've got to mentally go back to pre-pandemic times when you really had to pay attention to some of that stuff.
We do. And so it's challenging because we've all adopted to different methods of living. And so to go back.
When I think of employee turnover, right, there's probably a lot of employees in those pharmacies that weren't there when you had to pay attention to all of those things.
Absolutely. And it's so hard. One of the challenging things I learned as well in LTC, to take a sidestep, is the training of a good technician is much more difficult in LTC. It's a much longer lead time to get someone because there's so many more nuances to prescription orders and understanding times of administration and things like that, where you never deal with that on the retail side. So a good technician, it takes much longer to train them, to get them to be efficient and develop them. So and it's hard, that the environment, right? The recruiting and hiring environment is just very different and difficult in that. So the signature logs, the last thing I'll say about that is a handwritten date. What a lot of people unfortunately trap into is when you print a manifest of all the things that are in a tote going to a facility, it may have a pre-printed date. But PBMs know that may not be the date that it's delivered. You may be preparing that in advance. The cycle is getting prepared in advance, days before it's actually delivered. And so a pre-printed date is not necessarily when it gets delivered. And what the PBM truly cares about is when did it arrive at the facility. So we will see problems where there's a pre-printed date, so the nurse or whomever at the front desk signed for the drugs, but there's not a handwritten date that goes along with that. So they will reject that signature log and say, we need something more cooperative to do that. Now, technology, if you have an iPad or something else that the nurse is signing, it might be time-stamped or date-stamped, which is great. But it is a challenge with printed or physical hard copy manifests if it has a pre-printed date. Just those
little
things,
right?
Can get a pharmacy into so much trouble, right? It's not like you didn't have a valid order, that the patient didn't go write the med. You can't prove to us that they got it on a signature log. Well, I have a MAR over here that shows the nurse administered it. Is, and now it's very tricky, and that's something that traditionally on the LTC side we see problems with on signature logs.